Hello, my name is Jalen Avila, and in this video, we are going to discuss how to identify fractures using your ultrasound and how to perform ultrasound-guided hematoma blocks. Your probe of choice, for the most part, is going to be the linear transducer, although if you are looking at a deeper bone, such as the femur, such as the humerus, you might want to switch over to that curvilinear transducer. Let's start off by looking at the distal radius. I'm using my linear transducer and just placing it over the distal radius here, and we'll identify a hyperechoic or white cortex. It's nice and smooth right here. And then over here, we're seeing some of the hand bones with the tendon overlying these bony structures here. Now this right here, this is what a joint looks like. A fracture would have a disruption of that cortex and a step off, either above it or below it. I'm going to take a brief pause here just to let you know that all of our content is on the coreultrasound.com website. That is ultrasound podcast, 5-minute sono, ultrasound of the week, clip bank, and we also have our courses page where we have the core ultrasound fundamentals and core ultrasound question bank, where you have 3,200 questions with feedback, including narrated videos explaining the question. Check it out, and back to your video. When you are looking at a bone to identify a fracture, make sure that you look at every part of it that you can. Remember, the bone is a 3D structure. So look dorsal, look ventral, look medial, look lateral, look all over that bone, because even though a section of that cortex where the patient has swelling, presumably, even though that section might not have a fracture, that doesn't mean the part next to it won't. So make sure that you create a 3D representation by looking at every possible aspect of that bone. So over here, we have a normal distal radius right here. We're tracking this cortex along until we get to the wrist joint itself, no fracture there. And over here, we're seeing a disruption, a step off. This is the more proximal distal radius, and this is the distal radius. So see how there's a kind of jump right here, a step off? This is what a fracture looks like. And over here, we have the wrist joint itself. This is a bit more of a dramatic view of a distal radius fracture with some dorsal angulation. We're seeing that right here. This is a joint, and this is the tendon overlying it. There's a bit of hematoma right here as well. Now, we can also look at some of the more deep bones. This is a humerus right here. So notice we have the proximal humerus right here, and then we have a break, an angulation, and the distal humerus over here. This is what a humerus fracture looks like. And right here we have a femur fracture. So this is the more proximal segment, big old step off, and then here is the distal segment right here. This is what a fracture looks like on ultrasound. Now, I'm going to be honest with you here. I'm not usually using ultrasound to primarily diagnose fractures because I have x-ray for that. But what I am doing is I'm using it during the reduction to help with knowing if I have adequate reduction or not. So over here on the left side, I have a pre-reduction, pretty big step off here. After my first attempt, it's much better over here. And then second attempt, this is acceptable angulation. And this is where I practice clinically the most common indication for fracture ultrasound. All right, let's talk about hematoma blocks. Now, this is pretty simple. You're basically just identifying that disruption in the cortex, and then you are placing a needle under ultrasound guidance directly into that fracture. So right here, we have cortex, we have a bit of disruption right here, and right here we see the needle. And you can see I'm angling that needle that I'm seeing in the long axis directly into that fracture. I'm doing little aliquots of the local anesthetic to know exactly where my needle tip is and to make sure that I'm anesthetizing the area surrounding that fracture rather than just in the fracture itself, to just numb some of the muscles, tendons, and possibly ligaments in the area. Here's another fracture right here, a bit of a disruption here. We can see that needle tip coming into view and injecting directly into that fracture itself. You can also do this in the short axis. Here's a distal radius fracture right here. And you can see here a little hyperechoic point right here. And you can see that as I start to inject, you can see the fluid kind of infiltrating that area and causing some of the tissues surrounding it to just move out of the way. And that's how you perform an ultrasound-guided hematoma block. Now to recap, for the identification of a fracture, you're going to look for a cortical disruption. Beware of joints. If you see a fracture or what you suspect is a fracture segment and it's very rounded and it's right at where a joint would be, just be cognizant of the fact that that may be a joint and not a fracture. And make sure that you use your ultrasound if you're performing a hematoma block for that precision injection directly into that fracture segment. That's it for this 5-minute sono video. I hope to hear from you soon, and happy scanning.